Good morning, Mohan sir, George sir, all senior consultants, colleagues, friends. Today we are starting our sixth breakfast CME. This is by the Department of Radio Diagnosis. It's about the advances in radio diagnosis. Today we have five speakers: Dr. George sir, Dr. Tara Pradap, Dr. Julia Chaco, Dr. Rajesh Anthony, and Dr. Michelle. The session will be chaired by Dr. George Joseph, who is the head of the Department of Radio Diagnosis. We invite all the speakers to please come on stage and start the proceedings. Over to George, sir.
Good morning, everybody. Today we have a discussion on recent advances in radiology. The first talk is by me. It is recent advance in MDCT imaging. It will be followed by talk by Dr. Tara regarding radiology revisited, followed by Michelle on recent advances in ultrasound technology, and Dr. Julio, MR elastography, and Dr. Rajesh on intervention today and future. My talk is on recent advances in CT imaging, that is MDCT. At the beginning, I will start with some of the applications of MDCT and some of the representative images which we have acquired from our 64 slides last 5 years. This is a useful investigation for renal evaluation. It's called a CT urogram. We can see the all urinary tract by this investigation, renal function, any calculus in the kidney. Here we can see as two small calculi in the collecting system, and it is an ectopic kidney. This is coronary angiogram, CT coronary angiogram. We can get excellent picture like this. It is negative predictive value is very high, and at present positive predictive value is also high. This hepatic angiogram is very useful in liver transplant evaluation and hepatic resection cases. We can demonstrate all the arteries, hepatic venous system and the portal venous system in a single study. The renal angiogram, very useful investigation for transplant cases. We can demonstrate the number of arteries, any renal abnormality, any calculus in the collecting system. CT is the investigation of choice in pancreatic disease, and it gives an excellent picture of the curved reconstruction images of pancreas. It's called CT pancreatogram. We can see the dilated duct calculus here, portion of the CBD here, and this is a volume rendering image showing numerous calculus scattered in the parenchyma. CT colography is not much used, but in some cases it is useful, and we can demonstrate any filling defect in the colon, just like a Berry enema double contrast study by using CT, MDCT. Another application is virtual endoscopy. We can demonstrate after doing the colography, we can demonstrate, we look into the lumen of the colon to see the lesions. Then pulmonary angiogram, very useful investigation. You can see the filling defect in the pulmonary artery, right pulmonary artery, and in the left pulmonary artery. And in the same study, we can demonstrate the thrombosis in the leg veins. CT enterography is a unique application of MDCT where we can study the small bowel loops. It demonstrates the wall, lumen content, perienteric areas, mesentery, momentum and adjacent organ in a single study, that too within 4 seconds. These are the features of small bowel involvement in Crohn's disease. All features are well demonstrated. Cerebral venogram is a useful investigation. We can demonstrate the thrombus in the straight sinus and the sagittal sinus and the transverse sinus very clearly. This is polytrauma evaluation. We can cover the whole body in 8 seconds, that is 910 mm. And the radiation dose we can reduce by reducing the factors. This is done on 3 millisievert radiation. This is the evaluation of the CT scanner. The first 4-slice CT came in 1998. Then the 16 slice came in 2004 and the 64 slice in 2005. We acquired a 64 slice in 2009, I think. Then the next generation scan came, that is Discovery 750 high definition CT, that is spectral CT scanner. Then the latest introduction is the 16 centimeter covering CT scanner. That is the latest introduction. What is new in MDCT? DECT is the newer technology. It is called dual energy or multi-energy CT. Dual energy imaging is a promising new development in computer tomography that has the potential to improve lesion delineation characterization beyond the level currently achievable with the conventional CT scan. What are the advantages of spectral CT? It brings more clarity to the characterization of indeterminate lesion. This small for characterization lesion, especially in liver and kidney, can be characterized by spectral CT. That is, I think less than 2 millimeter we can characterize. Then successfully scan more patients, including those with metallic implants, especially in ortho cases. Then triage and stratify kidney stone patient faster through quantitative stone characterization. Gain richer information on tissue pathology without radiation dose penalty. Reduce radiation with optimized contrast media exposure, improve workflow, and potentially eliminate non-contrast scan. How it works? Uses two separate acquisition, one at 140 kVp and another at 80 kVp. Allows reconstruction and viewing of monochromatic, that is single energy images from 40 kV to 140 kV. Technical aspect. There are 3 types of dual energy CT. Siemens uses dual source dual energy, that is 2 X-ray tubes and 2 rows of detectors that will rotate around the patient in a single rotation. In single source DECT, that is by GE Healthcare, single X-ray tube rapidly alternate low and high energies, that is within 1.25 millisecond there is alteration of the 40 and 180, 140 kV. Then the third one is detector based spectral CT, that is by Philips, single X-ray tube with detector made of 2 layers sandwich detector which simultaneously detected 2 energy levels. DECT scanner can process both routine diagnostic images and material decomposition, that is material density images. Advantages of monochromatic images. It reduces the artifact from metal, calcium, iodine or other high attenuating material. Quantitative information about chemical composition of the kidney stones are possible. Iodine response at low energy may open up opportunities for IV contrast dose reduction with low monochromatic KEV images. Spectral scanner, the lesion identification with accurate material composition. Any material in the body can be identified with its atomic number. Material based images differentiate enhancing versus non-enhancing lesion. Monochromatic images for low iodine, improved visualization. Accurate stenosis estimation for all non-invasive CT angiogram, including coronary angiogram. This is an example. The first one is a conventional CT. There is a suspicious area of hyperdensity in the cortical sulcal spaces in the frontal region. In water density image, there is no lesion in that region, corresponding region, but in iodine density, the iodine is picked up more and we can see suspected lesion there which require further evaluation. Similarly, in pulmonary thrombosis, the iodine density images will be brighter. This is a conventional CT, 64 slice CT showing filling defect here, which is followed up by a GSI dual energy CT after treatment, and thrombus has resolved. Then spectral KV iodine augmentation. This is the example of HCC. This is the conventional CT. There is a suspicious area of enhancement in this region, and in the low KV images, there is conspicuous enhancement in that region. And in iodine image, it is very clearly seen, just like an MRI picture on the other side. This is the most useful investigation for characterizing small lesions, that is multiple lesions in the liver, which we report as too small to characterize. The spectral Hounsfield curve in the aorta can be, aorta is this blue color, and it shows increased uptake of in the low energy level. The lesion with red and yellow arrow, the spectral curve are confirmed to be enhancing just below that of iodine in the aorta, and it definitely says it is an enhancing lesion. And lesion that is in the pink color, which is showing negative value, which indicates it is iodine lipid containing lesion. So it is a benign lesion. The other two are enhancing lesions. Another advantage of dual energy CT is we need not take any plane scan before starting the examination. After giving contrast, the iodine can be eliminated from the study, and we can get virtual non-enhanced image, almost same quality. These are two examples, two levels. We can see the quality almost same plane scan. Then another important advantage is we can see change the energy level in the images, not the window setting. Energy level we can say change, and we can identify the calcium and clearly identify the lumen of the vessel, and degree of stenosis of the vessel can be done in cardiac CT. Another example showing clearly delineate the lumen of the artery there. Then another important application is plaque characterization in coronary angio. We can identify soft plaque, calcific plaque, and fat containing plaque by metallo decomposition. This is the calcium curve. We can see it is going up in the low energy level. Then next comes the iodine in the lumen of the vessel, that is just below the calcium. Then comes the soft plaque, which is very low down. By measuring the Hounsfield unit there, we can say the nature of the plaque. And the lowest most one, that is lipid plaque. Another important role is in the pulmonary embolism. We can demonstrate in the spectral image, we can demonstrate the perfusion defect in the involved segment of the lung. This is the area of perfusion defect due to embolism. And this is the iodine map in blue color, you can see the black area which is reduced perfusion. Another indication is the stent bleeding after intravascular stenting. Here we can see the 80 kV image. You can see a small hyperdense area here, and in 55 kV it is more conspicuous. That means there is a bleed there from the stent. And in the iodine density image, only iodine will be projected, and that is seen as very clearly there is a leak there. And in water density there is no hyperdensity. This is the liver enhancement pattern. We can see the standard axial images, and on 55 kV the enhancement of the lesion is very high compared to the standard. So the lesion pickup is more. This is an important application of DECT. We can discriminate between various types of cysts, especially hemorrhagic cyst or any enhancing component in this cyst. As small as this can be, very small 1 millimeter lesion can be picked up in multi-slice CT, dual energy CT. This is the 140 kVp. We can see the cyst here is showing minimal hyperdensity. In monochromatic image it is slightly hyperdense, and in water density image it is dense compared to the other images. And in iodine density it is hyperdense. That means it is not enhancing. Another example you can see here, the monochromatic image it is hyperdense. In water images it is hyperdense. That means it is hemorrhagic. And in iodine density image it is non-enhancing. So it is a simple cyst, hemorrhagic cyst. This is the example of virtual virtual plane imaging, where we can take a delayed or nephrographic phase of urogram, and after that we can recover the water-based image, that is negative non-enhanced image, virtual non-enhanced. We can pick up the stone there inside the collecting system, which is opacified in the delayed section scan. So renal calculus characterization is another important role of dual energy CT. We can discriminate between uric acid calculus and calcium and other non-uric acid calcium by denoting the Hounsfield unit. Another example is cholesterol calculus in the gallbladder can be identified very clearly. Here in the conventional scan there is no calculus. In iodine density scan we can see there is a hyperdense filling defect in the gallbladder that is equivalent to that of fat density, and in the fat density we can see the increased density calculus in the gallbladder lumen compared to that of outside fat. GSI application in image quality enhancement. In brain, the streak artifacts of the posterior fossa are eliminated. Other examples are the metallic artifacts from internal fixation, then dental artifacts, all can be eliminated in final image. These are some examples. This is the routine 70 kV image of aneurysm clip. There is lot of streak artifact, and the metallic artifact reduction system, we have eliminated the odd artifacts from the surrounding metallic area, and the vessels are clearly demonstrated. This is the advantage of DECT. Another example is splenic artery aneurysm after coiling. The artifacts are suppressed by the metallic artifact reduction system. So another example is the gross artifact which is corrected by the MRS. This is another good example. where the prosthesis artifact is completely reduced, and we can see the bone inside and the soft tissue very clearly, denoting some pathologies there inside. Another example, knee joint, this gross artifact is there, that is corrected there, and the vessel arteries can be well delineated. Another example after fixation of the fracture. The most notable application is the management of gout. Successfully revealed monosodium urate crystals in and around the joint in gouty arthropathy. Can discriminate between pseudogout. As an example, this is calcium material density image. This is uric acid density material image. We can see the increased density there, corresponding calcium density, there is reduced density. So you can discriminate between uric acid and other calcium deposit in the joint by doing DCT. This is a pseudogout showing calcium density image where there is increased density in the joint space, which is not present in the uric acid density images. That discriminate between uric acid and pseudogout. This is the slide showing the typical coverage by a CT scanner. This is a single spiral scan. It takes 40 seconds to do an abdomen. Dual slice it takes 28 seconds, and 4 slice it takes 12 seconds, 16 slice 12 seconds, and 64 slice 4.5 seconds. And the recent scanner, which is a 16 centimeter wide detector, covers it in 1 second, and even 0.8 second it covers the full abdomen. See more, know more, less dose and faster is the present situation. This is the Revolution CT uncompromised. It's ultimate answer to most of the limitations of MDCT. Revolution certain unique features are it is 16 centimeter wide full gemstone spectral detector, 1 rotation, 1 organ, 2 rotation, 1 region. That is the 1 rotation takes only 0.28 seconds. That is about 2 tons of this tube and detector is rotated around the patient in 0.28 seconds. The whole organ perfusion and angio together is another feature. Then cardiac, it is 1 beat cardiac angio. Motion-free coronary image at any heart rate with 0.28 second rotation speed and snapshot freeze that eliminates the artifact, motion artifact. Any heart rate, no rate control medication is required. Need only 1 rotation at 0.28 second. Ultra low dose in any cardiac examination, all heart into 0.28 second with a cardiac dose of below 1 millisievert. That is, we can do 20 cardiac CTs in 1 year in a patient if required. Functional cardiac and dynamic myocardial perfusion is possible. Whole body can be finished in 4 to 5 seconds. And it is supported by a powerful workstation AW-V7. These are some of the image in high definition CT. From the high definition CT, we can see the soft plaque in the distal to distant in the coronary artery very clearly. This is a comparison standard resolution and high resolution CT. We can eliminate the calcium blooming in the coronary arteries. This radiation dose is 1.56 millisievert. This is the stent evaluation. We can see the sequential stent put in the coronary artery. The lumen can be very clearly demonstrated, and in-stent stenosis can be demonstrated. That is, here there is a filling defect there compared to the 10 region above. These are high definition cardiac CT images that is done on 0.31 millisievert and 0.47 millisievert examples of images. Excellent visualization of lung in lung window despite continuous breathing. This is taken during the patient breathing. There is no image degradation. Regarding contrast also, with the advent of the 16 centimeter detector CT, contrast dose can be reduced to 20 cc of contrast media, or below that we cannot go. Minimum 20 cc you can do a angiogram.